During my mental health clinical rotation, I learned a lot about what it's like to work in a mental health facility and what it would be like to be a patient coming through and all of the resources that are available. To start my day off, I was in the psych ICU and I got to kind of experience all of the different kinds of patients that would be in there. They gave us a report sheet that said all of the reasons why each patient had been admitted in the first place, and then just kind of some demographics about each of them. And that was very interesting to see what kind of patients are triaged into the ICU part of the mental health facility. I also watched one of the charge nurses and just how she interacted with a lot of the patients, and I was very, very impressed with just the dignity and respect and kindness and compassion that she offered to each of those patients. Even if they were not saying the kindest things to her or to us, she still treated them with a crazy amount of respect and kindness. She was really great with like de-escalation techniques, and she just knew exactly when to use each one of them for each type of patient. Like some people, she was able to kind of talk calmly and slowly and calm them down. But with other patients, she knew that maybe they were attention seeking, so, to kind of ignore them or just not give them what they were looking for, because that would only make them more angry or more riled up. So I thought she did a great job with maintaining safety of the unit and also just treating each patient like they were human and like they deserved respect, which I really appreciated. But after we left the psych ICU, we went into the group therapy sessions, and I really enjoyed that as well. It was kind of a lower acuity, and so it was outpatient, so they came from their homes and they would attend a 3-hour session together, and we watched a video during that week, and then they had some activities and then speaking time. And they involved us students in it, which I thought was really cool. They were all very open to talking in front of us and welcoming to us, which was really sweet of them. But I learned, like, in those group therapy moments, how important it is for people with mental health, certain mental health disorders or situations, for them to be in community with other people like them that are going through the same things, because they were able to bounce ideas off of each other and just kind of vent with each other, and they were able to understand what each other were going through more than, if I were to go in and try to relate to them if I didn't have like a certain mental health diagnosis or was not going through the same things as them. So it was really cool seeing different people in the community being able to come together and, get some help by a trained professional, but also just getting help from each other and through their different life experiences. And then after that, we went to admissions, and we were able to work with some of the social workers to do an admission interview and just kind of see how that went. And it was very, very interesting. Just being able to piece together what we have learned with different psych diagnoses. I was able to see a patient that had depression, and so seeing her answer the questions on that and how her signs and symptoms of depression matched up, with what we learned in the textbook. I was also able to see someone who was hearing voices and had been diagnosed schizophrenic. And so, just seeing how not only like his mental state and verbally, but it also had affected him physically. You could tell he was very uncomfortable and his head was hurting a lot. And then lastly, there was someone who was manic, going through a manic episode of bipolar disorder. And so, some of the things on the questionnaire he didn't answer that I would have thought would have been, led towards, like, a manic episode. But the way that he was talking, very much was, like, very hyper and energized and, nonstop, and just kind of had just ideas all over the place, which whenever I asked Mrs. Adair afterwards, she said that is a sign of manic episode in bipolar disorder. So it was a very interesting day, and I learned a lot from all of the staff members, and I really appreciated the experience. So thank you.